I thank the SMS for his reply. I have a few supplementary questions. Firstly, while these errors were actually discovered in a review process, since the error actually started in 2012, why did it take so long to discover the errors? Is it a standard time frame for enough statistics to be to flag out a possible error? And secondly, would the ministry consider a second independent test for serious illnesses? Last supplementary question is about compensation to the victims. What sort of compensation is being considered, and is a lifetime of free healthcare on the cards? Thank you.
So let me clarify the member's misconception. When I say in my reply that KTPH is reviewing all the results from 2012, 2012 was taken at a point in which the test first started in KTPH. It does not mean that all the results going back to 2012 are erroneous. So in that sense, KTPH is being prudent and careful by going back super kiasu, going back all the way to when the test first started. It may well be that the errors could have occurred in the last 3 months or 6 months. I think the key point usually is when the reagent has been changed, a different brand of reagent, or a different provider of the reagent could usually be the starting point of why the protocol or the test conditions were no longer as optimal as it should be. But going back to 2012 when the test first started was really trying to be comprehensive and to be careful to make sure that we don't miss anybody in the process. It doesn't mean that the test was erroneous from 2012. So the results of the review are still ongoing, so I do not want to prejudge the review process from the experts. Let's wait for the experts to look at all the results going back to 2012 and then decide at which point, what step of the process that could have been where the error occurred. Now, when it comes to the question of whether you're going to get compensation, I think, as I said earlier, any treatment cost due to the treatment arising from a positive HER2 results, in other words, usually treatment with Herceptin as the drug, the cost of the drug likely will be refunded. Any investigation or tests or treatment of any related complications as a result of, say, Herceptin would also be refunded as well. But to then say that this translates to a lifetime of compensation, I think that would be a little bit too far thing to stretch, because most of the complications, if any, or most of the side effects relating to the treatment are transient. Diarrhea, a bit of fever, a bit of chills. They do not have long-term consequences. They are not long-lasting. And I think we have to take that in the correct context of medical treatment. I hope that answers the members' questions.
Hazel Poa.
I also have a question about a second independent test for serious illnesses.
I take that as a general question, which in any form of medical diagnostics, if the clinician is unsure that a particular test alone cannot give you a high degree of probability of predicting a positive diagnosis or presence of an illness, then it behoves clinical judgment to call for a second test. But immunohistochemistry is a specific unique test. It does not necessarily mean that an alternative is available, although in the literature, there are other alternative tests that could be done, but we have to consider that against the time needed to do it, because that could delay treatment, and also whether that brings on unnecessary costs. So that, I think we should leave it to the experts to come up with a process guidelines on what is a testing algorithm to decide for Herceptin-related treatment.
Dr. Lim Wee Kiat.